Hi, my name is Morgan. This is my patient Caitlin, and we're going to be doing a quick assessment. So I'm going to start out by assessing her head. Everything is symmetrical or normocephalic. Temporal arteries are present. Going to assess the temporomandibular joint. Go ahead and open your mouth for me. Okay, temporomandibular joint is normal with smooth movement, no limitations or tenderness noted. Facial expression is appropriate for behavior. Facial shape and structures are symmetric. Go ahead and just sit straight for me. Good. Eyebrows, nasal, labial folds, and the sides of her mouth are all symmetric. Skin color and pigmentation is even. No swelling or involuntary movements of the facial muscles noted. Her neck and head is centered in the midline, and accessory neck muscles are symmetric. Head is erect and still. Now we're going to do some range of motion. Go ahead and tilt your head back for me. Good, into the center and front. Good, to the side. Back into the other side. I'm just going to do a little bit of resistance, okay? So go ahead and tilt your head back. Good, and then front. Good, to the side. And then to the other side. So range of motion is smooth with no tenderness noted and no limitations. Okay, so now we're going to assess the cervical lymph nodes. Periocular lymph nodes, posterior ocular, occipital, submental, submandibular, jugulodigastric, superficial cervical nodes. Go ahead and tilt your head a little bit. Deep cervical chain. And again. Posterior or cervical. And then go ahead and raise your shoulders for me. And supraclavicular. I'm just going to feel for a carotid pulse. Carotid pulse is even. And I'm just going to listen. Carotid pulse is even upon auscultation. So looking, I'm just assessing the trachea. The trachea is midline and symmetrical. And I am unable to palpate her thyroid gland. So I'm going to give her some water. You hold that. Tilt your head a little bit for me. Okay, go ahead and take a drink. Okay, good. And tilt this way. And go ahead and take a drink. Good. Thyroid tissue rises with swallow and then returns back to its resting position. No enlargement noted. It's consistent and symmetrical with no nodules present. If the thyroid was enlarged, I would auscultate for a bruit, which she has none present. All right, next we're going to move on to her visual field. So I'm going to have you follow my pen. Good. Good. And good. I'm going to check your pupils. Pupils react briskly and are equal. Good. I'm just going to assess her hands and her nail beds here. Skin tone is even. She's got pinkish tan skin. A small amount of freckles noted. Temperature is warm. Skin is smooth and firm. The epidermis is uniformly thin. No edema is noted. Just going to check for skin turgor. Skin turgor has quick return and is elastic. Okay. Nail edges are smooth, rounded, and clean. Nail beds are normal with the 160-degree angle present. No brittleness, thickness noted, and unable to assess the color of her nail beds due to nail polish. So I'm just going to assess her hair. Hair is thick and shiny and evenly noted throughout the head. So next what I'm going to do is talk about an ophthalmoscope. So an ophthalmoscope allows for a clear vision of the eye and the retina, and it provides a larger image to the viewer. So down here around the base of the head, there's a disc, and that's how you turn it on. You rotate it, and then a light will turn on. And then a little number will appear, and that is your focusing point, so you can adjust that to make sure that you have a clear image of the retina. Down here, there's another disc that you can adjust the light. You can adjust how bright it is, you can adjust how wide it is, and you can adjust the color of the light as well. And like I said, this gives a larger view of the retina of the eye. So what I'm going to do is use my ophthalmoscope, and we're going to look at her eye. Sclera are clear, conjunctiva are clear, no drainage is noted. Okay, and that concludes this assessment. Thank you.